I deal with question answer sessions. But today there was a lot of inquiry on my WhatsApp that tells something about ADHD, some cases of ADHD, and how actually we basically look at ADHD for treatment, or for that matter autism and all. So I welcome you all. I hope everybody joins in very early. Welcome, Dr. Ritu. So let's start the first. I'll take basic question, Dr. Navjot. Good afternoon. So first, let's start the basic understanding of ADHD. First of all, let me tell you that I have had a lot of successful cases where I have been able to treat ADHD and give very good results. And those children are now grown up, and they are some are in school, some are doing good job. So I have the journey of the patient right from when he was born till he's doing in 12th class or doing a good job in studying. So it's a long process, and I've been able to handle a lot of cases of ADHD with homeopathy, and they are showing very good results. So as you all know that ADHD, basically, if you see in ADHD, you can say there are few symptoms of ADHD that you have to remember always, like lack of attention to details, or that poor organization skills, inability to focus, misplacing things, forgetfulness, restlessness, difficulty in keeping quiet, and they keep talking, and there is a lot of fidgety feeling or hyperactivity or impulsivity, and persistent repetition of words. So these are basically the symptoms of ADHD. And the problem, yeah, Dr. Abel, hello. And what happens, the problem starts where we start prescribing on these symptoms. Now if a case of ADHD comes to you and you start prescribing a symptom that the patient is very much hyperactive, and if the patient is hyperactive, then you have a lot of remedies for hyperactivity, and then you prescribe and it does not give results. In ADHD, for example, if you see a rubric that the patient is very active, or he's very hyperactive, what happens in this case, if you're prescribing only for hyperactivity, so it will not give so much results, because it will treat the hyperactivity. It may sometimes curtail the hyperactivity, and some other symptom would start. So you will be basically jumping on symptom, and after 1 year you feel, oh, why did I give so many medicines? For example, there are remedies like Hyoscyamus ignitia, Lachesis, opium, sepia, spigelias, spongia, viratrum. These all are very hyperactive drugs. You prescribe this to a ADHD patient. If you see the patient very hyperactive, you keep on increasing the potency, and you will see that basically it does not give you that result which you are expected to give in ADHD. So in ADHD, it is very important to understand first in which symptom to prescribe, and why did the patient suffer from this. You will see in a lot of cases that you always keep telling that look at the pregnancy history, look at the whatever the lady is thinking during pregnancy, and that affects the child. It is true, but in lot many of cases you see that everything history is normal, there is no problem, still the basically child suffers from ADHD. And then the question arises, why? So this why is very important. Now, for example, I'll share you a case. So we had a case where the child was suffering from ADHD, and on history, I can't tell you the whole history because it will take a lot of time. In this, what happened? The patient basically was very hyperactive, very eager, very impulsive. There was no focus, always impatient. And in the history, we saw that there was everything absolutely fine in the family. The mother was very rich, but he was a very high placed officer in one of the government jobs. So they were the mother and father were very pally with each other, but the wife always said that actually I am very close to my husband, but I don't get time with my husband. During pregnancy also he was always busy. I know that he is busy, and he is genuinely busy. So there is no grudge, but still I feel that I could have got somebody to talk to. If I get somebody to talk to, I feel happy, and I did not have my husband. And some things which you can only talk to the husband, you can only talk to the husband. You can't talk to anybody else. And so this was the history. But still, this was not so much important, because she had taken a lot of treatment and there was no result. What do you think of this in this case? What do you think in this case, and how do you approach a case like this, where you feel that everything is so fine, everything was going so fine, and why did the child suffer from ADHD? So this is how you have to approach a case. Don't only go for symptoms, that impulsivity and lot of then big rubrics and themes, that he's trapped, that he can't do this and he did not get love and XYZ. A simple case. So I prescribed the patient a single dose of argentum nitricum. Argentum nitricum I started with. I repeated argentum nitricum the first day, on the 15th day, and in the next month also. And after about 1.5 months, the child started getting better. And now the child is itself in 10th class, doing very well in the exams. Previously, the child would not able to sit in the class. The school had to basically provide one ayah, which was paid by the mother and father, so that she looks after the child does not run out of the class. And now the child is performing very well. He's always in the top 5. And I prescribed the patient argentum nitricum. What do you make of this case? Simple. I always believe that homeopathy is simple. It has to be understood first, why and how. Just the polycrest remedies I normally prescribe, and I get wonderful results. Yes, Dr. Amit, good afternoon. Anja, good afternoon. Dr. Visha, good afternoon. So, how do you make of this case and how do you proceed? This was the basic crux of the case, the crux of the history, which I use for practice. And normally, I enter the case with 1 or 2 rubrics. Of course, then when you get the remedy right, you see that everything fits the remedy. So, how do you look at this case? I prescribed argentum nitricum the first day, 15th day, and then in I think after 2 months, and gradually after 1.5 months, the patient started showing good improvement. And now, if you see that patient, you cannot say that he had ADHD problem. For example, I had one child who was so restless, when he was in the 2nd class, I think he came to me, and now he's in the 9th class. And if you see the video of the child before and after, you will say that he is not an ADHD child. So the first case of argentum nitricum, can you understand or can you see why argentum nitricum was given? Anybody? See, I don't want to discuss just everything about ADHD, the symptoms, then what happens in ADHD, what are the 3 main symptoms of ADHD. Like, if you understand the medicine part of ADHD, then we say that inattention is there, impulsivity is, hyperactivity is there. So that's why ADHD. But let us see the homeopathy approach so that I'll be able to understand. Well, Dr. Amit, I am waiting for the Google Meet to share with the group. Okay, now it is up to you. Yes, Dr. Babel, want to speak to someone. Yes, that is important. That is so important. So can you make something else of that? Okay, something else? See, a simple rubric. That's what today I wanted to share a few cases of ADHD. Okay, when I'm on Google Meet, I'll see the videos also of the cases. So simple rubric. A simple rubric desires to talk to someone, but she did not have that. And that's why what happens? The disease starts. She had suppression of desires, thoughts, and will, and the child has developed that hyperactivity. Now, the husband and the wife has to take more care, more love, more attention, more talking, because the child is craving what he had lost or what he did not have during pregnancy. So simple rubric, a simple symptom, desires to talk to someone. That's why I gave the patient argentum nitricum. And that was the remedy. If you see argentum nitricum, there are so many symptoms of argentum nitricum. But then these symptoms, how to enter the case? Of course, then the patient had and then when we saw the case, the case had all symptoms of argentum nitricum. That craving for sugar and the fear, the anxiety, the anticipation, the hyperactivity, everything was there in argentum nitricum. And if you see argentum nitricum, we can't ask the child, what are his ideas, what are the emotions, but argentum nitricum, tormented by strange ideas and emotions. So a child may be he must be thinking this. You cannot understand what the child wants to talk, and that's why he's hyperactive, restless. So argentum nitricum covers that also, tormented by emotions, nervous impulsiveness, hurried, yet timid and anxious. That is argentum nitricum. Yes, good afternoon, Dr. Vashi. So did you understand argentum nitricum and the travel of the case of ADHD? That is very important. Did you get that? And then you have a lot of symptoms of urgent like that incoherence and the childish talks and irrational, and these are all symptoms then of urgent nitricum. But how to enter the case, that is important. If you enter the case only by hyperactivity, or if you enter the case only by that symptoms of impulsivity, or you enter the case just by inattention, you will get only few remedies. You can prescribe tarantula, you can prescribe belladonna, you can prescribe hyoscyamus, you can prescribe stramonium, you can prescribe these remedies basically which are so commonly used, and you only see those cases which are cured. You don't see the hundreds of cases which are not cured. That is the point. Yes, Dr. Aslesha, welcome. Good afternoon. So this was one of the first cases in ADHD. Now, any questions, or I can go further? If you have any questions, you can always ask, so that urgent terminate. So in this case, it is so important to I just today wanted to just share how to enter that case. That is important for me. The attachment part is so important, and I have seen, that is my understanding of ADHD, whatever cures I have taken. When we start a Google Meet with Dr. Amit, then we'll share some cases. It is very important to have that love hormone oxytocin properly working at the time of pregnancy. Just change your perspective and think about that oxytocin hormone. If you understand that hormone, automatically you will understand why does the attachment in the fetus during pregnancy have so many effect in the childhood, or so many disease we have. It is so important. If you understand the hormone oxytocin, if you get time, automatically you will see that the prescription of yours will be more beyond your thinking, because that attachment is not there. That can be for a friction of time, that can be for some time, that can be for some hours or some days or some months of the pregnancy history, with the patient sometimes forgets. Then on recollection in case testing, if you find, oh my god, that was the entry point. So this again you have to go and read. Again, in ADHD, it is so important to understand for which symptom you are prescribing. People keep on asking me that, sir, we have seen 3 main symptoms of ADHD. I would say then you must remember some 12 symptoms of ADHD, like unfinished tasks, problem playing quietly, difficulty remaining silent, or emotional outburst, self-focused behavior, lot of interruptions, inability to focus, repetitions. And then you prescribe remedies for this type, that the patient cannot concentrate, and the remedies change, and the patient always does something every half. कुछ भी काम करेगा, थोड़ा करेगा, भूल जाएंगे. He does things for some time, then forgets, then changes things. So we say changeability is there, the chaotic nature is there, impatient is there, but these are the normal symptoms of ADHD. That's why you normally do not find so many good results in your practice, because you're prescribing only your normal symptoms. Then look what I have seen, the oxytocin hormone, the attachment, the love hormone, where did that break? Was there hypo or hyper? And then you can see, for example, if the patient suffers from too much hyperemesis gravidarum, too much vomiting, and she has taken a lot of remedies for that. Now, that is syphilitic nature. Then you have to understand why so much hyperemesis. When was the attachment lost? You can have lot of permutation combination. If you want, you can write down, which I have seen in my practice. For example, the first one, after marriage, the couple comes and tells you that we are now pregnant, but we wanted some more time. So when there was a pregnancy, we thought whether to abort or not. We were in dilemma. Then we consulted some doctors, some elders, a mother, father, and they told us, first child, just go with it. Don't do abortion, miscarriage, don't do. It will happen. So that period of not being attached to that child, that has caused that inflow, the negative inflow, and then the child suffers from XYZ disease, ADHD, which I have seen in many of cases, and you must have also seen. But the problem starts when we keep thinking that elements from dominance, elements from being alone, very abusive husband in pregnancy, and then we start prescribing on those terms. So this part is so important in ADHD, the attachment. Second, which I told you, everything is there, but she does not have the husband to talk. She does not have the husband because husband is working out. That's only phone talking, and there's always that emptiness in the female mind, and that emptiness sometimes is transferred, and then you see that this is a this symptom basically will cover in ADHD elements from being alone. Are you with me? Are you getting me? That just I wanted to share because there were a lot of questions on ADHD. I will finish, then you can ask some questions. Third, commonly I'm telling, of course, third symptom you can take elements from dominance, and then you can have a lot of dominance of husband, dominance of mother-in-law. Normally, mother-in-law basically you will find in many cases in India, always the mother-in-law basically is the enemy, and there's always the problem with mother-in-law, and or the father-in-law, somebody dominating. Third part, the wife basically did not want to marry the person she is married, and then she conceives. So she's not prepared. She's not prepared, mentally prepared to get along with the pregnancy or get along with the husband, and then that symptom starts. Third part. The fourth part, you see that the patient is already under treatment for some disease, like she has diabetes, she has thyroid, she has hypertension. This also sometimes affects the thinking and the ADHD part of the disease of the patient. For example, you see that the patient suffered from thyroid. See, the patient suffered from thyroid and the brain was not developed properly, and suddenly the doctor says that because of thyroid it is possible that your child may also have thyroid problems, or the child may have loss of the child may be dull with dull intellect, and intellectually he can be weak. So eat good food, and that state of fear, that state of anticipation, that state of forebodings, that state of anxiety is always present, and that can lead to these type of disorders. Okay, Dr. Sartaj has one question. A girl unable to conceive from last 3 months. Yeah, I'll answer a question, but then at least give me a. Okay, so I think this is it for ADHD, and then you can find other cause. These are the 3-4 main causes of ADHD. What I have found, of course, vaccination is definitely there, one of the causes. And then in today's world, do think that the patient suffered from COVID or took the vaccination, and how many times from COVID, and whether she was given a lot of antibiotics or that remedies injection. That has also affected the human economy, and then we have symptoms of ADHD. So these are the basic what you call the prerequisites, the preliminary things which I wanted to share with you, because there were a lot of questions on WhatsApp and I wanted to answer in general, so that whatever questions you give me on my WhatsApp, I can't every time answer you singly. So I always take those questions and try to answer so that everybody gets to know, and then it's very easy for me to answer, I hope. But I think there are a lot of other questions now. So I'll first take those questions. A girl unable to conceive for last 3 months. Yeah, give me the case so then I can share something. Now, having mapped tongue, teeth, 73 as male with constipation like sheep's dung, 20 days opium, 30. Should I go for 200? No, first of all, Dr. Singh, if the patient basically suffering from stools like sheep dung, and the patient is 73 years of age, so in this case, stools very hard, stools sheep dung has to be removed mechanically. I would not suggest you to definitely directly go for the medicine, because in old age there is a problem of peristalsis, there is a problem of atonicity of the intestine, and there is muscular problem. So normally you see in old age, lot of people have this problem. So sometimes opium will work, sometimes opium might not work. So you can just take one symptom if it is old age. For example, I had told you something about constipation of old age. And of course, if you want some remedies there, the stools have to be removed mechanically. There are a lot of remedies. Now, if you try to club those symptoms like old age constipation and the stool have to be removed mechanically, you can write down there are few remedies which are very close, having both the symptoms. Of course, one is opium, and you can always try 200. But for me, don't repeat so much. 1 or 2 doses, just wait. and see how does the body react. You can think about selenium, you can think about bryonia, conium, sulfur. But let me tell you that conium will conium has given me a lot of good results, because it is called as the balm of Gilead. Old patients, stools have to be removed mechanically, and stools are hard like sheep's dung. Everything is covered by conium. So do look about conium. Some other remedies that you should think in old age for constipation, those are antim crude, sorinum, naxomica, phosphorus, and lacasis. Okay. Liver hemangioma is treatable or not? If yes, what is the approach? Yeah, liver hemangioma is treatable. The approach I would see, take the whole. I think suggest take the whole case, and then see symptomatically. And in this case, in liver hemangioma, it is very important to understand how long, how chronic is that hemangioma. How many years it has been the patient suffering hemangioma, and whether that hemangioma is disturbing the patient. If it is not disturbing the patient, then wait and watch. Don't treat. If it start disturbing the constitution, then you can always think of prescribing constitutionally. Irregular periods after marriage, and girls suffered from COVID in past and treated with homeopathy. Now, if I have given you that COVID-19 nosode, do use that nosode as an intercurrent, or try to open up the case with that, and then find out the whole case. Whole case is important. And keep sharing the COVID-19 nosode which I have sent you, so that it's very easy for me to make a summary of that COVID-19 vaccine, the remedy. Yes, Dr. Madan, good afternoon. Sir, you said wife may feel lonely or feel neglected, husband is away or busy, but what remedy should we think about in such cases? Yeah, see, Dr. Sangma, good answer, and I am happy that you have asked this answer. Now we are talking for the child. But if you ask me that which remedy you should think about when the wife has a problem of elements from being alone, let's see, there are a lot of remedies, but 4 to 5 remedies which I have found very, very useful in my practice. You can write down. First is Kalikar, second is phosphorus, third is Merxol, fourth is Lycopodium, and fifth is Sepia. These 5 remedies have given me a lot of good results, and it is there in their Materia Medica and repertory that these remedies have this problem. Then you have some rare remedies like Aurum muraticum, or you have bismuth, or you have Ranunculus bulbosus and Miserenum also, which has given me good results. But these 5-6 remedies basically have given very good results to me. Ovulation also doesn't occur in the girl unable to conceive with early menstruation. So please give me in this case what. Yeah, so Dr. Sarda, we have to see first test the anti-Mullerian factor, AMN, so that we come to know that part in the ovary is there. If it is not there, then the patient is suffering from ovarian failure. And if the patient is suffering from ovarian failure, then make sure that it's a chronic syphilitic condition. Take the whole case, and this whole case don't repertorize with some soric and psychotic rubrics. Repertorize with syphilitic rubrics. If this type of case comes, 2 or 3 syphilitic rubrics, sometimes 2 syphilitic rubrics can sum up the case. So it is important to find, because in cases of ovarian failure or in cases of ovulatory cycles, these syphilitic symptoms become very important for us to understand and then prescribe. Yes, so I hope you got the answer, and it's definitely a very interesting condition to treat, because see, treating that ovulation and treating those conditions and giving child to the couple is the most what you call beautiful things in the world to do, no? Yeah, so pug dog. 3 dogs in family, medium black skin cancer behind right shoulder or ribs at level of liver, very dready, incredible, hungry, greed, cold, seeks warm, pushes forward at fending and treats, can't wait and stay seated, shakes head and tension, afraid of get nothing. After feeding, standing at corner and moves head slowly from right to left. Umbilical hernia as puppy, lots of tatter. Wow. Very nice, Dr. Babel, and it's a very interesting case taking from a dog. You have really worked very hard. So in this case, of course, whatever little knowledge I have treating dogs, I think I must have showed you some cases of cancer of dogs or maggots which I have treated. But yeah, you can. So whenever in this case, there are some things very, very important, that you have to see. In this case, whatever case you have told me, three remedies come to my mind. Three remedies which are very, very important. First is definitely, I think must have tried also, that is phosphorus. First is phosphorus. Second, again very close to that, is baptisia. Third is phosphoric acid. And fourth remedy that I would suggest you to go and read, and that remedy is called as the tree of heaven. That remedy is called as tree of heaven, and that I have used in my practice and have got good results. So make sure that you treat these 4-5 remedies and then see the action of the remedies. Lastly, in these cases, if you find the breed that the mother, the child, the mother and father of the dog, that their history of cancer, they also expired because of cancer or some syphilitic disease, then make sure that you start with 1 dose of carcinosin and then see how does the dog react. One thing also I would like to add in this case, in the case taking, understand how the dog is sleeping, and is there any change from normal sleeping pattern to the sleeping pattern after cancer, or change of sleeping time from normal what he was to what he is now. Always take the symptom from where what the dog was and what is the dog now. That is very important. If you get that, yeah. So we want the difference of before and after. Just in ADHD, I told that if you prescribe on impulsivity and restlessness, on repetition, that's a normal symptom. But that every child has some very different symptom from the normal. For example, if you ask my colleague who is working with me, she took a case of ADHD child where the child was absolutely calm and always listened to her mother. Whenever he was hyperactive, the mother told do this, and the patient listened to the child mother, and then we prescribe on that, because there was something very different from what is normal in ADHD. So these are the 3-4 remedies which basically that you must remember. Yeah, tree of heaven. I think once I had told you something about tree of heaven. Anybody who can say the meaning of tree of heaven? Tree of heaven means Elianthus. Elianthus glandulosa. That is tree of heaven. You understand? Elianthus glandulosa. That is tree of heaven, and that is also a very important remedy which fits in your case. Kindly share some experience of yours on acne in women in late 20s and early 30s and share the remedies too. What can we say? Acne is at see, whenever if you are prescribing some cases of acne, and in ladies, if you see, and if they're getting at this age, so first at least clear that the lady is having no menstrual problem, because I have seen as the age advances the acne starts coming basically because of either using of lot of cosmetics, or some menstrual irregularity, or some gastric derangement. For example, if the lady is suffering from menstrual and third thing is during pregnancy or after pregnancy also, this acne, late acne come. So we'll go step by step. First of all, see the menstrual irregularity. In this, if you find a lady suffering from menstrual irregularity and then suffering from acne, of course, the first remedy you should think about is pulsatilla. But I have found very good results with Semesifuga, Berberis equifolium, sanguinaria, and graphitis. Very, very important remedies. Next, if the acne are during pregnancy, then one remedy will be very important in most of the cases. Belladonna, sabina, sepia. Very, very important. Okay, neither cosmetic, neither menstruation. So in this case, you have to see generally the remedies of acne in a lady of 30 years, then the remedy would be Kali Brome, Naxomica, Teucrium varum, Syphilinum, and one remedy is fluoric acid. These 5 remedies basically I have been using in my practice and I have got very good results. Okay, but generally I have seen, because of gastric derangement, because of menses problem, because of use of lot of cosmetics, these I have seen in. But in your case, if you're very clear, then these 5 remedies basically should work in your case. I hope, Dr. Babel, you get and if you can get that case in that our bi-monthly meet and show the dog's photograph, no, I'll be very happy to treat that, because that will be something very interesting. Okay, yeah. So next we go to some next question. Patient wants to make house under water to see animals. Wow. Active child. I asked if she wants to drink. She said, why all are you asking? I don't need. Patient wants to make house underwater to see animals. Yeah, so the patient appears crazy and the patient does not want to talk to the doctor. That's what I make of this case. So the patient, I think, has love of animals, but she's being very crazy and she's being very, what you call, haphazard. So very haphazard, does not understand what is right and what is wrong, whether she's thinking right or whether she's thinking wrong. So in this case, of course, you can take love for animals and there are a lot of remedies, but I would basically go to the patient constitution, why she's behaving in such a way. She wants to build the house underwater, so she's crazy. And there are a lot of other words for crazy, so that if you see craziness, so there are a lot of other things in crazy. For example, if you see the word crazy, now craziness basically would arise because what is sora is important. Sora of the person is, I always say sora is very important. Why? Because why did the patient had so much, what you call, craziness for animals? You can say the patient is become insane, mad, absurd. It is a bizarre, foolish. This is, or hysterical, you can say. These are the different, what you call, synonyms or very close synonym rubrics to craziness. You can say the patient is insane, bizarre, absurd, very foolish. So why, of course, these are the rubrics which you can say, but why the previous note, just a minute, I just forgot what was there. Good afternoon. And yeah, so Dr. Patient, I can only read, Dr. Madan, that patient wants to make house underwater to see animals. That's what I'm telling you, something about craziness. Dr. Matrona says, I have one patient that has delusion that tell you evil authorities are good and we organic therapeutics are forceless to cure. What remedies help? Can you elaborate more? Because I am not getting the questions, that whether she is not happy with the doctor, with you, that is Echne remedy in gastric complaints, Dr. Sangma. It's to see Echne remedy because of gastric complaints are very easy. I think if you see also in your if you try to analyze yourself, you can get the remedies. Those are very simple remedies. First is Antim crude, second is Carboveg, Naxomica, and of course don't forget Robinia. I'm working on the case delusion. I did not get evil authorities are good. I'm not understanding that delusion part because I'm not getting the questions properly. You want that the please read previous questions. Neither cosmetic nor menstrual. Dr. Madan, I cannot get the question because I think it must be have scrolled up. So if you want, you can always write the question again and I'll be able to answer that. Okay, because there are a lot of questions coming up and it has, you can always write the question. I'll just tell you, I'm just working on the case of Dr. Metrona. he thinks suppressive doctors are good and other remedies doctors are forceful. Now, yeah, so basically what happens in this case, why do you want to take delusion? First of all, now she feels that whatever is there on the surface, just give the remedy and I'll be fine. Don't take the whole case and then try to cure me. So she's being very rude, I think, in telling that uh, separate doctors are nice, because she has not seen the results. We have a lot of cases where the patient comes and tells us that we don't believe homeopathy because how will the small pills cure diabetes or blood pressure or X disease? So it is not a delusion. It's basically it's her experience. No, so I will not take that symptom as delusion. It's an experience. So she has never seen or experienced the cure in homeopathy. That's why she is very rude in talking, abusive in talking. That you can say. But is she abusive now, or her sora was also abusive? If abusive secondary to something, then it is not important, because she's tired, she's unhappy, she's what we call, she's just seen so many doctors, has not given results, so she's behaving in such a way. So check the sora, and this is her experience, so I would not take that as a delusion. I hope you get what I want to convey to you. And I hope, Dr. Sangma, you got the remedies for AKNA from gastric derangement. It is Antimcrude, Carboveg, Robenia, Naxomica. Yes. Dhanyavad. Okay, fine. So do we go further with some questions? Dr. Madan, I hope you can write the question again. Or we basically start with that dog. Elianthus is a very important remedy, and I think Elianthus, Dr. Babel, we have discussed in a monthly meeting also and in the YouTube also. I told you something to see in the YouTube, something about I had posted a beautiful video of I don't think that I don't know whether the video has been posted. The fever of Cilicia, very important symptom of Cilicia fever. And I've posted some videos which are very wonderfully I've cured in my clinic recently. So I've just put that cured videos. If it is not uploaded, I'll make sure that is uploaded, and you will find sometimes the polycrest remedies, we only remember those remedies for the symptoms which have been taught very frequently in college or seminars. But sometimes these remedies only have such interesting symptoms and such symptoms which we have never heard of, and then we prescribe and then we say good result. In the same context, I have uploaded few videos in the YouTube. Do go home and see the videos, and you will get to know something about the polycrest remedy, its rare approach and its rare indications, which are very important in our practice today. Yes, so any other questions, or I'll take some questions from the WhatsApp. I have this on my WhatsApp, lot of questions, or some questions are there. We have all questions answered, Dr. Madan. I think, yeah, you have put. Female 8 years from 2 weeks, diagnosed purpura, echimosis, lower extremity, red spots appearing, then it's darker, soles are these spots and painful, touch walking, likes animals. Yeah, okay. So, Dr. Madan, first of all, you have to understand what is echimosis. Echimosis, just by symptom, if you treat and you don't understand the cause, then you can land up in few remedies which are very common. Echimosis, basically, if you see echimosis in a repertory, first of all, echimosis, you have to understand that these are the dark purple spots which form under the skin because the blood leaks into the top layer of the skin. It is usually from injury and it is about a ½ inch longer. Okay, so it is important that what causes echimosis, that is very important. And if you understood what causes, just you want the remedies for echimosis, then it is very easy. In homeopathy, if it is said that echimosis, if you don't get the remedy, but still if you want to prescribe, so it is very easy. Just think about sulfuric acid, think about arnica, and think about ledampal. These three remedies are very, very important, and if you learn this remedy, it would be very easy to understand this. Of course, there are few remedies like mercor or vipera or phosphorus, which are again very, very interesting. But three, four remedies which are very, very important that you have to understand is sulfuric acid, ledampal, and arnica montana. Sir, my mother tincture Crataegus Q. See, Crataegus Q, if it was dissolved 12 years before my practice, I had a lot of case of CABG. Today I also have, but then I also started using Crataegus Q, but it does not, though it is written in Boric Materia, if you see Boric Materia Medica on the left side in between, it is written that Crataegus has the solvent power over the crustaceous and calcareous deposits in the arteries. And if you prescribe Crataegus, then if Crataegus have been started working, then you would have so less cases of CABG or so less cases of coronary artery blocks. Nobody would have required surgery. But atherosclerosis is basically a condition of the arteries where the arteries develop a lot of stiffness, a lot of calcium deposits, and the elasticity has been lost. So I always tell that this is because of deep-seated emotions, deep-seated emotions, and I always say it is because of grief, and more frequently silent grief. So in this case, you do think about these conditions, silent grief or grief in general, and then if you prescribe the remedies, depending on the whole case, the body itself will heal. Only Crataegus would just heal symptomatically. In some case you might get results, in some case you might not get results. But if your remedy is right, you will always find that your remedy will start working from day one, and the patient feels that freshness, the breath comes easily, the dyspnea goes, the pain goes, and the patient starts feeling better within your prescription 2 or 3 days. So my suggestion, if it is your parents and all, you can always start Crataegus Q. There is no harm in starting Crataegus Q, but a constitutional prescription is definitely required. Okay, I hope you understood something. So let's go further with some further questions. Yeah, thank you. I hope that you just prescribe good constitutional medicine, because he has to come out of it. It's definitely treatable, and we have a lot of cases where we have been able to remove the blocks in the coronary arteries. Dr. Madan, I hope you got the answer, because Echimosis में 3-4 remedies which I instantly get in my mind is the 3 remedies which are truly. Of course, there are 4-5 remedies which I added, like phosphorus and China sulf also with arnica or sulfuric acid, vipera. These are very common remedies, and first it's very important to find out the cause of Echimosis. Echimosis, it appears very easy on paper, like, okay, that black spot, blue spots and all, but it is important to understand that why it has happened. Yes. And sometimes applying ice on the lesion also symptomatically lessens the pain and lessens the swelling also in case of Echimosis. Yes, any other questions, or we are done with all the questions today? So basically, if you understand, if you see cases where the patient says, that the heart feels as if caged and all, and you'll be surprised that if in angina, if you ask a patient, that caged feeling basically is there in many of cases. So normally, symptomatically, if you start prescribing cactus to all cases, that will not relieve. Caged feeling is basically very different, and understand that feeling in the SORA and the psychosis and syphilis, so that your prescriptions are basically not only related to symptoms, it is related to miasms and related to the history of the patient. That's why we have the whole history, the family history, the past history, patient as a person. In that case, you basically see the whole constitution, and then you can prescribe. That's so important. For if you still have fear that what will happen to my father, you can always You can always prescribe these remedies, but make sure that the case taking has been done. For any questions? Like if you open cactus grandiflorus, I told something about cactus grandiflorus in my previous. Cactus grandiflorus are persons basically who have very sanguineous uh, congestions in persons, plethoric habits, resulting in hemorrhage and apoplexy. That is that is cactus grandiflorus. It's a classical remedy for hemorrhage from the nose, from the lungs, from the stomach, from the bladder. It is so important you can compare cactus grandiflorus with phosphorus or millefolium or these remedies which are hemorrhagic remedies. If you just remember one symptom of constriction, then you always think that, oh, constriction is not there, so cactus will not be indicated, but it is there. These symptoms of hemorrhage, these symptoms of sanguineous personality, congestive personalities, if you go and enter the case through these, whole body feel caged, means these persons basically are very emotional persons and they are bound with that emotional tags. So they find so much frustration, so much tagging, so much caged feeling, that they cannot get off the emotions. They feel always bound with somebody, and that is how the cactus stays developed. That's why there are a lot of grief silent in these type of cases, and then cactus works beautifully in cases of CADA and or any CCF. That caged feeling, emotional caged feeling, that is important in cactus grandiflorus. I hope this was an example given by me basically, and this is how you understand the remedy. I hope you got something, Dr. Agrawal, with this, or whatever explanation which I gave you. Next question. Or today everybody's understood very fast everything. It's not like that, no? Yes. So if you see remedies in, again we'll come to ADHD. If you see remedies in restlessness, so you see ADHD basically personalities are very restless personalities. And just by seeing that restlessness, if you start prescribing arsenic or belladonna or camphor or cuprum or calcarea, so you will only give symptomatic relief to the patient and not a curative results. In fact, I have seen in my practice, if restlessness is very pronounced in that case taking, and the mother, father, everybody just taking on restlessness, then ask or try to define the restlessness. How is the restlessness? How is he becomes restless because of anger? He is more restless in the morning. Acha, Dr. Agrawal, yes. Cactus grandiflorus, Dr. Agrawal, it is written in a Materia Medica. You know that it helps in dissolving the crustaceans and the calcareous deposits in the arteries. But as homeopathy science, basically we have a basic tagline that in homeopathy we treat the patient and not the disease. That's important. So if Crataegus would have dissolved all the clots in the arteries, today we would not have so many cardiac hospitals for CABGs or angioplasty. You can definitely start prescribing Crataegus because there's no harm in it, but a constitutional remedy is very important. Rainy weather's remedy. Rainy weather's remedy, basically, if you see, I have already made a YouTube video, Dr. Gupta, and I have about that person that honors all evil authorities, especially doctor. He himself is an organic therapeutic, but he has a deep delusion about suppressive medicine. Even he was once cured by HP. Okay, well, fine. So remedies I have already basically prescribed in many of my webinars and all. So you can go and see that. But see, in general, if you ask me remedies, there are 5-6 very important remedies you can write down: Dulcamara, Bryonia, Rustox, Phosphorus, Cilicia, Tuberculinum. These 5-6 remedies are very chronic and constitutional. Acute, Oriendo, histamine, arsenic is chronic also. Eucalyptus, Sabadilla, Solanum lycopersicum. These 6 remedies for acute complaints. That's why. Can the constitutional remedy be given in impotency if the patient is hypertensive? Why not, Dr. Singh? And LM potency, if you can use not only in hypertensive cases, Normal cases also, if you have LM potency available with you, you have to use LM potency, because what happens in Organon sixth edition, Hahnemann has written that whatever I have written till now, basically you can it's no, you can stop thinking, and now the new therapy is the LM potency. For example, 246, 240, 249, and he has written in detail about this LM potency, and it is very important to understand about LM potency, how to give, how it came into existence. And for this, I have already taken about 3 or 4 lectures of LM potency, and I have described in detail about LM potency. If you get that LM potency in my YouTube, or I think I have done in my YouTube or Facebook, I don't remember, it's there on the YouTube or Facebook. You do go, and it is in 3 parts, and I have just discussed everything about LM potency, so you could get basically a very good idea about LM potency if you go see the video. Metrona Milka, wonderful, wow. Okay, thank you so much. So we go further, and if you are engineer, Dr. Agrawal, it's so important, that you understand homeopathy, and basically we give results with homeopathy. How does it work? It's a wonderful science, A girl 13 years old says she hates her parents because they force her to attend private lessons and feels that they put pressure on her. She is very angry and can even hit her mother. Yeah, very nice question. And may I know who is Dr. Porvavu? Where are you from? Yes, you are from. Where are you from? Such a very interesting question. It's an interesting question, and you have to think about remedies which are basically, if I am a right-handed person or I am a left-handed grease. Yeah. So I'll give an example. If I am a left-handed person and my parents basically, parents basically tell me, no, you have to write with right hand, you have to write with right hand. And I'm fed up with that. I am so angry. I feel that I am a left-handed person. Why are my parents? And I become very angry. And then I start hitting my parent. I become abusive. Actually, I am not. But because what am I? I am not being able to live that, and I'm basically changing because of something else. That means there are 5 6. First you have to understand what is the entry point, what are the symptoms, and what rubric you should take for prescription. Very, very interesting rubric. Will, contradiction of, will, contradiction of. And the remedies we have: anacardium, kalicarb, lachesis, silicea. Of this anacardium and kalicarb, has given me so many results, lot of results I have. We have some rare remedies also, like opium, like sepia. If you see sepia, it is written elements from dominance. So you can take that rubric also, elements from dominance. And then we have other sets of remedies: sepia, lycopodium, carcinosin, and folliculinum. Will, contradiction of, we have brattacarb also. We have iridium, we have capsicum, we have aurum metallicum, we have anolinium. So these are the group of remedies that comes to your mind. But the basic understanding of the case is elements from dominance and will, contradiction of. I hope you understood this. I hope Dr. Purvavu, I hope I am pronouncing it right. This is how you have to understand the case. First of all, don't jump to the remedies. Remedies will come automatically. First, understand the case, and then if you understand, automatically you can get the set of remedies for the symptoms, and then you can prescribe in these cases. I hope I was able to make you understand the concept and then the remedies. Okay. Yeah, thank you. Yeah. CPI is good. Yes. See, all remedies are good. It depends on what you take for prescription. That is so important. And you'll be surprised. Lachesis has been taught to us in so different ways. He's very witty, he's very loquacious, he's so cunning, everything. But if you see the rubric, will, contradiction of, it also has lacuses. So don't understand only Materia Medica from one angle. That's why we make mistakes in repertory, and that's why we make mistakes in a prescription, because we have fixed thought about the remedy that anacardium has two wheels and malicious angry remedy. Kali carb, very stretchable remedy, everything emotional, workaholic, lacuses, cunning, witty, because it's an animal. But if you see will, contradiction, all these three remedies are present. So if you are studying Materia Medica, you have to go beyond the symptoms and understand, and you have to read by yourself. Don't follow persons or doctors who are basically have their own concept, because the basic books of Materia Medica are very important to read first. If you make some set of fixed notions of some remedies, you will not be able to crack the case. And that's why whatever videos I upload in my YouTube channel, those are videos of the polycrus remedies which have got results in some unique symptoms of that remedies. Or for example, I've started those making cases, or telling cases for OPD diaries. I have, I think, shared about 60 to 70 cases on my routine OPD diaries, which I've putting on my WhatsApp group. And if you see in those cases, those are very polycrest remedies, but that symptom, how to take out the symptom, and the other side of the remedies, that fixate, if you leave, you will have so many wider area, range of the polycrest remedies, which are also prescribed and which are also useful in complaints you have never thought of. So give a thought to that, everybody. It's a general answer to everybody. So it's already 4 o'clock, and I hope that I was able to answer your question. And Dr. Amit's, we are waiting for the Google Meet. So make a good group and then we can start that Google Meet. Okay. So everybody, thank you for joining, and see you next time on my next YouTube live. Thank you so much.